Putting a breast implant in is kind of like putting a magnifying glass on the breast. So
The actual filler material, the silicone gel, has different types of cross-linking, so it can actually feel less firm or more firm.
if you know you want a higher amount of volume, probably choosing an implant is better for you because it's a guarantee.
To simplify it, you want to, as a patient, realize implants come in a certain width and a certain thickness, so that sort of determines your look.
The beauty scientists, Dr. Christy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Welcome to the next episode of The Beauty Scientists. We are talking about natural breast augmentation today. Amazing topic. I'm Dr. Christy Hamilton, board certified plastic surgeon, here with Dr. Roy Kim. How are you doing, Roy?
I am good. How are you doing?
Great. So we have two board certified plastic surgeons talking about a topic that we're both passionate about. So patients come in, and how often are they asking for a natural breast augmentation as opposed to an unnatural one?
Yes. As a plastic surgeon, we both of us know, we love it when patients want and say natural. We love it when they bring inspirational photographs. But I guess our problem as plastic surgeons is generally, okay, how do you translate what a patient's saying into what I can achieve as a plastic surgeon, specifically the natural breast augmentation? What do you really consider a natural breast?
Yeah. And, sometimes I do have patients that come in, they're like, oh no, I do want that really round, really augmented, like clearly fake look. But most of the time, that's not the case. Most patients come in asking for natural. And that's when we really try to get in their minds, because I think to you and I, a natural breast is one that's a teardrop shape. There's more volume at the bottom of the breast than the top. Your breasts are not pushed together, so you don't have cleavage when you are out of a bra standing there, and nipple position can vary a little bit patient to patient. There's all different types of nipple position and breast shape. But that, I think that's what you and I think of. How would you define it?
Everything you said, and the other tweak is we're talking about natural breasts, in other words, no support. So with an underwire, with side pushing in, that is a nice look, but that's technically not natural. So breasts will separate and they will drop slightly with no support. And even though you and I think that that's a natural breast, I think what a lot of patients feel is, hey, with a low-cut dress, with a special blouse, with a special outfit, I would be able to push them up, push them in, and have some cleavage. I don't necessarily want to live my life like this all the time, although some patients do want to live like that all the time. So this is why having a natural look, but being able to have cleavage without having an unnatural look, unnatural touching together, symastia, all those good things. I think that's what most patients want, but I have to figure that out, and so do you during the consultation.
Yeah, so we have to get in the patient's head, and then that's one of the, I ask the same question. So do you want to look like you're in a push-up bra all the time? Some patients, they're like, yes, 100%. And I would agree. I would argue that that's not natural, but it is a look, and it can be a very pretty look. And I always remind patients too, it's like, hey, not only is that the look that you're going for, but do you want to look like that all the time? Because you could choose something that was more of a teardrop, a smaller volume breast implant. And then if the dress calls for it, or it's Saturday night and you want to amp it up a little bit, you can always put a push-up bra with underwire on top of your breast augmentation and create more of that cleavage for that moment, but not have to look like that, Tuesday at 1 p.m. So Yep. That's also an important distinction for patients, because then, a lot of times they're not thinking about the fact that just like with unoperated breasts, you can also choose to enhance or minimize with lingerie and clothing. So this is why you and I were talking about this episode in advance, but photos, inspiration photos help so much, because that allows us to really get in the mindset of the patient and understand what natural means to them, because that term is used so loosely when we're talking about breast augmentation.
Yeah. So one of the big things we think about as plastic surgeons is natural look. So one of the things, of course, is cleavage, how full the upper pole, the sort of top of the breast look like. Another thing you mentioned is the nipple position, because sometimes I get asked, I don't want the look where the nipples are a little too lateral, too much to the side. And what I explain to patients is some of it's genetic. Some of it's definitely maybe the implant is placed too much in the middle and it's pushing the nipples out to the side a bit too much. And I guess the final thing is, honestly, it depends on the camera lens. So a lot of amateurish, non-professional photos. They may have selfie on, they may have photographs taken by their friends with the smartphone, but that's not a true nerdy macro lens with no distortion, which is what we like as plastic surgeons.
Right. And then we see this all the time with, oh, I don't look like this in photos. And they like, oh, how do you like yourself in the mirror? I like it, but not in photos. I'm like, well, we're not chasing virtual reality, at least yet. We like to chase reality. But to your point, putting a breast implant in is kind of like putting a magnifying glass on the breast. So if your nipples are already a little bit out to the side, you have to put the implant centered on the breast itself so that looks normal, but that's going to kick out the nipples even more to the outside. Or if they're a little bit up, a little bit too high, again, we'll amplify that, or a little bit too low. We usually actually see the nipples rotate up, but certainly from the to the middle or to the outside, unless your nipples are right in the center of your breast and you have perfect breasts, they're going to be moved a little bit in some direction, especially if you're choosing a larger breast implant. So that's something that's important to consider. And your plastic surgeon, like Dr. Kim or I, would make sure we choose an implant that really fits the width of your breast so that we're minimizing that kicking out. Like Dr. Kim you were saying, if you have them too close to the center, that will even more, especially shoot the nipples out to the side.
Yeah. And then the other thing, which patients sort of tell me, but again, this is nerd talk from two plastic surgeons, they want a natural feel. And so as a plastic surgeon, the technology is the actual filler material, the silicone gel, has different types of cross-linking, so it can actually feel less firm or more firm. Also, they've come up with different models where the silicone gel is actually the same. However, the amount of filling up the actual envelope, the outer covering of the actual breast implant, is more full. So there's less give. It does feel more firm when you feel it. And at least my preference has always been actually the softest feeling breast implants, which weirdly enough are the older models, to me feel the most natural after all the surgery's done, after all the swelling's done. I don't know what type of implants like generically you like in terms of feel.
Oh, I use all of them, just depending on what the keywords that the patient gives me. I let them feel them too. I agree with you. I think if you are coming in and wanting truly for your augmentation to look the most like natural breast as possible, we're choosing a lower profile, not a low profile, but a lower profile implant. We're choosing one of the softer gels, or either less filled or truly softer, because what we want is we want to see that implant will just melt into a more natural teardrop shape when you hold it in your hand. And that's the look that we're trying to achieve, because that's what natural breasts look like. But that's why the photos, again, are so important, because we can see if we see someone that really wants that pop up top or that really, really perky look, those can still look cute and certainly very tasteful, but that wouldn't be the most truly natural look from your and mine perspective.
Yeah. So how do patients achieve this look? I mean, one of the things we can talk a little bit more about is implant profile. So one of the things I like to tell patients is, Starbucks, they actually only have 3 profiles. They only have tall, grande, venti. If you went into a Starbucks and you wanted a grande plus or a tall minus, they'd look at you like you're strange. Well, depending on the company, Mentor, I believe, has 7, Allergan has 6 different profiles. And since they went to the same marketing department as Starbucks, God forbid you call them small, medium, or large. No, they have to be called moderate classic, moderate plus boost, high profile, ultra high profile. Names that honestly don't mean much unless you're looking at a chart. But to simplify it, you want to, as a patient, realize implants come in a certain width and a certain thickness. So that sort of determines your look. And then, Dr. Hamilton, if you want to talk about fat grafting and how that can enhance your more natural look even more.
Yes. And so fat grafting, or taking, you would do liposuction somewhere else in the body where you're willing to donate some material. And then we use that to either sculpt the breast itself. Like we could narrow cleavage lines, fill up the upper pole of the breast a little bit more, just do overall volumization. This can be done alone for a truly natural augmentation without a device or an implant, or it can be used in combination with an implant, because like we were mentioning before, we really want to center the implant on the breast width itself. We want that right in the center. If you naturally have cleavage lines that are really far apart, we don't want to put them so narrow that we kick out your nipple. So then this is a great way. If you add some fat grafting, you don't have to compromise on choosing the implant that's best suited for your the shape of your breast, and then you can still narrow the cleavage lines. So why someone might choose implants versus fat grafting: if you know you want a certain volume, if you know you want a higher amount of volume, probably choosing an implant is better for you because it's a guarantee. You know, you're choosing it, you're working with your plastic surgeon, right, Dr. Kim? And you can say, I know that you're going to get 250 or 350, whatever it may be. With fat, we know that there's some loss of the fat, not 100% of it will persist. Depending on what you read, is probably somewhere around 50%. It could be higher, it could be a little bit lower. And so it also depends on, you have to have a certain amount of breast tissue to receive the fat. So if you don't have a lot of breast to begin with, then you're only going to be able to transfer such a certain amount. And so there can be a little bit more variability in the outcome of those procedures.
Yeah. And one of the things is the intermammary distance. In other words, a very key component of cleavage is, okay, how close are your right breast to your left breast to each other? And so to narrow that distance, as Dr. Hamilton says, we could do it with implants, but if we could do it with fat, that's the ultimate, because we can sculpt the fat, control the fat, and give you the best overall result. I'm sure you've heard this before, Christy. We're trying to create sisters. We're not able to create identical twins. So that's one of the goals of breast surgery. One thing I noticed, on your social media feed is ballerina breasts. I don't know if you want to elaborate a little on that.
I love the ballerina breast philosophy. So these are very small augmentations, very elegant. We're going to be choosing not a low profile, but a lower profile implant for it. So we're just getting that kind of a yoga look in a small push-up bra, very tasteful, subtle cleavage, so that no one would ever know that that's an implant. You're truly leaving them guessing, is that she just have a tiny underwire on to get a little bit of that upper pole fullness. But it's a really beautiful look. And I was very interested in the comments on that post. So many women were saying that this was the look that they were trying to achieve, and then somehow they walked out of surgery with triple Ds. And it made me think about one of what I would say are lies we're taught in training, that women always want to be bigger. And I just think that that's not true. It can't, it can be. Some women say, hey, I want to get as big of an implant in as I possibly could have. But most of my patients, and it could just be my patient population, but they're really just looking to restore lost volume after having kids and breastfeeding, maybe slightly augment it, but they don't want to walk around with people saying, oh, wow, you had a great breast augmentation. They want to walk around just saying, oh, wow, look at that beautiful figure. She looks great. Not obviously that she had a breast augmentation. So they're very subtle, very pretty, very tasteful.
I totally agree. I think we may have a similar patient population because people in general don't want to be as big as possible. I think that they feel they're too top heavy. Rather, they want to be proportionate to their body and rejuvenated.
Yes. And a lot of women too, they'll say if you go too big with the implant relative to their hips and waist, they may find that they always have to wear really tight clothing. Otherwise, they might be super fit, super athletic, but they actually appear heavy because if they're wearing a sweater, all that material is kind of waterfalling or cascading off their breasts. And that also has the unintended consequence of making patients look older too, when they actually could be really, really young.
Yes.
So it's a more youthful, more athletic look, very tasteful. And when you're choosing smaller implants as well, there's less weight on the skin of the breast and the tissues of the breast. And so I find that those also tend to stay perkier and lifted longer than if you're choosing a very, very large implant. So a lot of benefits to it.
Yeah. So finally, how do you maintain this look? So you have breast augmentation, you have natural looking breasts. One of the things that I always tell patients, and I know you do as well, is scar maintenance is very important. Scars mature over 6 to 12 months. And even though it may be slightly annoying, over a long period of time, it's very good to use silicone gel to monitor the area, to make sure that it's healing up. So that's much longer than the actual procedure. What are your thoughts on the wearing of a bra after surgery, even though patients don't want to wear a bra?
They have to. I know. After they got especially with the fresh breast implants, they are standing up at attention, they are high and tight, and they have to wear the bra because now, even if you choose a small implant, there's still a new weight on your chest, and we want to keep everything as lifted and high as possible for as long as possible. And that includes patients that we put an internal bra in for, which is a type of temporary mesh that absorbs. But even with that, that's an insurance policy for your investment in your breast enhancement surgery. But you still want to do everything you can to keep everything as high and tight and lifted as possible.
Yes, I fully agree. And even though it may be a slight bummer where you have a great result and you don't want to wear a bra, hey, you don't have to wear a bra. It's just that, yeah, we strongly feel that wearing a bra will help keep them up for a very long period of time.
Yes.
Yeah.
That way you can stave off your having to visit us again as quickly in the future.
Or visit us again for a completely different reason. That's the hope anyway.
Yes.
Well, thanks so much for talking to me about having a natural breast augmentation. If you have any questions out there, whether you're a viewer or listener, please let us know, because maybe you have different feelings about what exactly natural breast augmentation is versus what Dr. Hamilton and I do. And as always, stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.